Hi friends, this is Dr. Nikita, your NEET PG mentor and a well-wisher who really wishes to see you pass with flying colors in the NEET PG. So this is the most important video of all the videos that I have posted up till now. This is about the cheat codes that you can use to score more in any exam, irrespective of your level of preparation. This is also the trick that I have been using all through my life to top the various entrance exams, because of which I could get rank 10 in Maharashtra State entrance, rank 63 in AIIMS MD entrance, and a 97 percentile in PGI entrance exam. But let me tell you that I was never ever a bookworm. This is only the cheat codes which helped me score good in all these exams. So I hope these would help you as well to top these various exams. There is a disclaimer that these cheat codes are an absolute ethical way to score more. Rather, these are the tactics that every topper uses in any exam. So do watch till the end to score more in the NEET PG. So the first thing that I would like to suggest is always use common sense while solving the questions. This is possible only if you maintain the calm in the exam hall. So example of this, now if you get a question, musculocutaneous nerve is a motor nerve, sensory nerve, mixed nerve, or an autonomic nerve, and you have no clue about what is the answer, you can still mark answer to this question. Anybody can solve this question. Even a non-medico can solve this question only if you know the definition of what is motor, sensory, and mixed nerve. So the thing is, if you decode this term musculocutaneous nerve, so it has musculo and it has cutaneous part. Musculo means it supplies the muscles, so it is motor nerve. Cutaneous means skin, so it is sensory. So it is both motor and sensory, so it is a mixed nerve. So now you know how to solve questions even when you have not read them, just by using the common sense. The next is identify the label structure in the image. Now, whenever you come across an image-based question where you have not seen this image anytime, whether this is X-ray, CT, ultrasound, MRI, does not matter at all. The first thing that you should see is look at the options. The options are right pulmonary artery, right pulmonary vein, left pulmonary artery, and left pulmonary vein. So from the options you can make out that this is something related to the thorax, that is the chest part, and particularly the heart. So you do not need to stress your brains on whether this is an image of the brain or the neck or the abdomen or pelvis. From the options you know that this is related to the thorax and the heart. The next thing is, if you do not know what is the image pointing to, at least with the basic knowledge that in a radiological image, this is the right side and this is the left side. So you know that this arrow here is, this is the midline, this is on the right side. So you know that the answer has to be right pulmonary artery or right pulmonary vein because the arrow is on the right side. So automatically you've ruled out option C, that is left pulmonary artery, and option D, that is left pulmonary vein. So the answer has to be either option A or option B. So even if you don't know whether it's a right pulmonary artery or a vein, you can mark any of these as the answer because there is 50% chance of getting the right answer, which is a very, very high probability. If you get this right, it will be +4. If you get it wrong, it would be -1. So the things would always be in your favor. So whenever you have questions where you have ruled out two options, always attempt those questions. Do not leave those questions unattempted. This is one of the mistakes that I had done in the first exam that I had, All India exam, but then I learned from it, and in the AIIMS exam I could do very well and get a rank of 63. So this is a very, very important trick, that start ruling out the options by using common sense. So now we know that the answer is either A or B. Now what is the answer? So if you see this structure, it is going into this chamber of the heart. So if you can identify this chamber of the heart, then also you can mark the answer, because we know that right pulmonary artery will come from the main pulmonary artery, which actually comes from the pulmonary artery, comes from the right ventricle. Right pulmonary vein, it drains into the left atrium. So is it right ventricle or is it left atrium? That is what we have to see. Now you know that how do we differentiate right ventricle and left atrium is right ventricle is the anterior most chamber. We have all read this in anatomy. And left atrium is the posterior most chamber. So if you see this chamber of the heart, is it anterior or posterior? It is close to the vertebra. This is the vertebra. It is close to the vertebra. Vertebra is posterior. So this becomes a posterior chamber, that is the left atrium. So since this structure is going into the left atrium, that is why the answer becomes right pulmonary vein. So see how you can solve these image-based questions, even solve the new images, especially the radiology images from the basic anatomy knowledge. Now identify the label structure in the image. The diagram is the same, just that the arrow now is pointing here. So as I said, look at the options first. What is the examiner trying to ask? So is it right atrium, right ventricle, left atrium or left ventricle? So basically the examiner wants to ask which heart chamber is it? So which heart chamber is it? So the technique here is, we said that this is the right side, this is the left side, this is the midline. So if you see this 4 chambers of the heart, you have this 1, 2, 3 and 4. So if you see this, this will become the left side, this will become the right side. So the arrow which is pointing here is on the left side. So you've ruled out right atrium and right ventricle. So 2 options are ruled out. So either it is left atrium or left ventricle, again 50% chance. So mark any of those so that there's a 50% chance. The next is to come to the right answer, left atrium versus left ventricle. If you see this arrow here is pointing to this chamber, and out of all the 4 chambers here, this is the chamber which has the thickest myocardium. So this has the thickest myocardium. So which chamber has the thickest myocardium? Left ventricle. So the answer is left ventricle and not left atrium. So this becomes the left ventricle, adjacent to it right ventricle, adjacent to it right atrium, and adjacent to right atrium left atrium. So left atrium is posterior most, right ventricle is anterior most, which is close to the sternum. Left atrium is close to the vertebra. So and this structure, if you see here, this is the descending aorta, and this is where you will have the esophagus. This is the left atrium, right ventricle behind the sternum, and this is the left ventricle, and this we said is the pulmonary vein. The next important trick is master the topic and not the previously asked questions. We all hear this many times that if you're giving this exam in 2019, solve the questions previous 5 years, at least 2015 up till 2015. But that does not mean that solving these questions as question answer will give you a rank. What do we mean by that is master those topics which are asked in the previous exams. Master the topics, not the questions. Example, anterior most chamber of heart is. Now suppose the image which we saw of the CT scan, where we were asked what chamber of the heart is this, which was the left ventricle. Suppose this was a previously asked question in the year 2017 and you are solving the previously asked questions. So when you solve such questions during your preparation or revision, you should know how to identify the other chambers. You should ask yourself questions, which is the anterior most, which is the posterior most. Everything you should know about the heart chambers. So basically, if there's a question on heart chamber in the year 2017, you have to master that topic, not just that how to identify the left ventricle. So if you do that while revising or preparing, you automatically know that it is the right ventricle which is the anterior most chamber of the heart. This is what we just saw when we were discussing about this image. That is how you should approach each question. Master the topic and not the question. The next is art of eliminating options. This is a very important trick, the most important trick to score good in an exam, especially which has negative marking like NEET PG exam. If you do that, it will give you a very good score and a rank. So coming back to examples, suppose the question is anterior most and posterior most chamber of heart are respectively. So anterior most and posterior most chamber of heart are respectively. You have solved the previous question. Anterior most chamber is right ventricle. Posterior most, let's say you do not know which is the posterior most. You had just read in the previously asked questions that right ventricle is the anterior most. So start seeing the options first. The options are right atrium, right ventricle, left atrium, left atrium, left ventricle, and left ventricle, left atrium. So you know that anterior most is right ventricle. So you have to look for options which has right ventricle as the first one, and it is only option B which has right ventricle. Rest is right atrium, left ventricle, which are incorrect. So only option B has right ventricle. So B becomes the answer. You have automatically ruled out rest of the three options and you have come to the right answer. So this is a very important trick. So now you know that posterior most chamber is the left atrium. Even if you do not know in the exam hall, it does not matter. Until you know only half of it, still you can solve the question. Next, same question, options are different. Anterior most and posterior most chamber of heart are respectively. We said that anterior most is right ventricle. Suppose we do not know yet what is the posterior most chamber. So right ventricle options are either option B or option D. You have ruled out option A, right atrium is not the anterior most. You have ruled out option C, left atrium is not the anterior most. So either it has to be B or it has to be D. You do not know which is the posterior most. Mark any of this. You will have 50% chance. As I said, it's a very high probability. So attempt these questions. That is how you increase the number of questions that are attempted. We keep wondering how do toppers attempt 290 or even 300 questions. Trust me, nobody knows all the 300 questions. It is just these tricks by which the toppers mark or attempt these many questions. Even you can do that by following these tricks. Now the next is same but the options are different. Anterior most and posterior most chamber of heart are respectively. We know anterior most is right ventricle. Three options have right ventricle. So either answer could be B, C or D. You have ruled out option A because right atrium is incorrect. So still if you mark any of these, so one of three would be correct. So you have 33% chance of getting a right answer. These are the questions which you should attempt only if the number of questions that you have attempted up till now are not good enough, like say you are well below 250. Then mark these questions where you have 33% chance of getting the right answer. That is how you can increase the number of questions to be attempted. If without solving such questions where three options you are confused, you have reached the minimum limit of 280 to be attempted, it is good. You can skip these questions and do not attempt these questions. So the next trick is use pre-existing knowledge. Coming to the example, retrosternal space obliteration is a feature of. So we are revolving around the topic of heart chambers. How can questions be twisted and asked on the same topic? So the importance of mastering the topic. So retrosternal space obliteration is a feature of right atrial enlargement, right ventricular, left atrial, left ventricular enlargement. So from here you know that the examiner is trying to ask which chamber enlargement causes retrosternal space obliteration. So again, if you remember that image which we saw where you had the right ventricle, right atrium and left atrium, this was the sternum here. Retrosternal space is behind the sternum. The chamber which is the closest is the right ventricle. So the answer will be right ventricle. So this term looks very difficult, especially in an exam hall. and if you have not read it, so retrosternal space obliteration, decode the term. Retrosternal means behind the sternum space. Obliteration means it is getting blocked by something. So which chamber will come behind the sternum? It will be the right ventricle. So when it enlarges, it will obliterate the space. So the answer is right ventricle. So see how the pre-existing knowledge that you have can help you solve new questions in the exam. Which of the following causes esophageal indentation? Again, it is based on the chamber enlargement. So esophagus, we know that it comes posteriorly. And which chamber of the heart comes posteriorly? Left atrium. So the answer will be left atrial enlargement. So correlate whatever you know about that topic. Only questions where you have no clue what is this question asking, leave those questions. Otherwise, attempt as many questions as possible by integrating whatever you have read in different subjects. So use the pre-existing knowledge. Everybody is in the scarcity of knowledge. Nobody will read everything which is there in the books. You have to use these tricks so that you can solve the questions. So the next is Googly questions. How do we tackle them? Trust me friends that in any exam you will face some Googly questions. Anybody, even a rank 1, will face the Googly questions. But how do you approach these Googly questions? So have a look at this question. All of the following are true for the contrast shown in the photograph except. So you know that the photograph is of the contrast. The contrast shown here is Omnipaque or iohexol. Read the image. Suppose this is an example where you don't know anything at all. What is Omnipaque? What is iohexol? But do not get panicked. Start looking at the options. The options are: it is a low osmolar contrast, iodine particle ratio is 3:1, it is an ionic monomer, it is a non-ionic monomer. So, generally difficult questions like this, you can catch them from the options. You can start ruling out options and increase your score. So if you look at option C and D, they both are contradictory. C is saying it is an ionic monomer, D is saying it is a non-ionic monomer. How can iohexol be both ionic and non-ionic? It has to be one of these. Either it has to be ionic or it has to be non-ionic. So non-ionic is the true statement. It is a non-ionic monomer. But the question is, all of the following are true except. That means which of the following is false. So the answer is it is an ionic monomer is false. Even if you do not know this, by the tricks which we have told you, you have eliminated option A, you have eliminated option B. Either C or D has to be the answer. So you have 50% chance of getting the right answer, which is a very, very high probability of scoring high. It goes in your favor. So is it low osmolar, high osmolar? Does not matter. Iodine particle ratio क्या होता है, कितना होता है, does not matter. If you know or you do not know, does not matter at all. Mark as C or D. Do not make the silly mistake of marking A or B as the answer. You are losing your marks like that when you mark those options as the answer. So read the options when you do not understand the question is an important trick. Now next is twists and turns. That is the same question, how it can be twisted. Read the question very, very carefully in that cases. Now similar question with the same image, but read the question carefully. All of the following are not true for the contrast except. So not true and except. Basically all of the following are not true means all of the following are false except. So now the question is asking which of the following is true. But again you have options here: ionic monomer, non-ionic monomer. So the answer has to be one of these. One of these can be true, both cannot be true. And we said that it is a non-ionic monomer, which is the true statement. So see that how the answer changes. If the question was all of the following are true except, means that which is the false, then the answer is C. If the question is all of the following are not true except, means which of the following is true, it is a non-ionic monomer. So one word change, that is not true except and true except, changes the answer entirely. This is a very, very common silly mistake which is made in the exam. So understand, read each word in the question very, very carefully. That will help you a lot to score more in the exam. Coming to the next trick, do not have pre-notions. Many times we have that habit of mugging up the question and answer. ये question आया तो ये answer, ये question आया तो ये answer. But MCQs is not like that. That is where examiners confuse the students. They will do one word here and there in the question and the entire answer will change. Example. Now, suppose you have a 45-year-old male presents with thunderclap headache. CT scan shows blood in sylvian fissure. Most likely diagnosis is. Now, first of all, thunderclap headache tells you that the diagnosis is subarachnoid hemorrhage. Blood in sylvian fissure also tells you that it is subarachnoid hemorrhage. So the diagnosis, you have ruled out option migraine or hypertension, because hypertension hemorrhage is not subarachnoid, it is intraparenchymal hemorrhage. So either it is MC aneurysm or AC aneurysm, again 50% chance. Next clue is the blood is in the sylvian fissure where middle cerebral artery courses. So the answer is MCA, aneurysm rupture. So if this is the sylvian fissure, this is the middle cerebral artery coursing through it. So if the aneurysm of MCA will rupture, there will be blood in the sylvian fissure. Next, cerebral artery runs. So for interhemispheric fissure, the answer will be ACA, aneurysm rupture, and not the MC aneurysm rupture like the previous question. That is why do not master the questions, master the concept behind that question. You should ask yourself, this time it's sylvian fissure, answer is MCA. What can the examiner ask me next time? So master all the fissures and the corresponding vessels which run through them. That is how you master the new questions that can come in the exam. The next is for image-based questions. Now, this was one of the recently asked questions with the image. A neonate presents with hydrocephalus and congestive heart failure. CT image is shown. What is the diagnosis? Now, suppose you are sitting in the exam hall and this is the question that you see. And this is the CT scan which is given. This is the CT scan that you have never ever seen in your life. Again, do not get panicked seeing the new image. Start thinking logically. This is a very good example of a question of image-based question which can be solved only with the clinical history. The good thing is generally with the images they give you the clinical history that can solve the question even without having a look at the images. So neonate with hydrocephalus and congestive heart failure, there can be only one diagnosis which is classical of vein of Galen malformation. So this is the vein of Galen malformation, which is actually a AV malformation in the brain which leads to hydrocephalus and AV fistula, hyperdynamic circulation, so it causes the heart failure. So there has to be only one diagnosis for neonate with hydrocephalus and congestive heart failure. It is vein of Galen malformation. Even if you do not know what is this image, CT scan, MRI, what is the image showing, still you can solve the question. So in image-based questions, clinical history helps a lot. So read the clinical history very, very carefully. The last trick is decode the new terms. There would be questions on new terms which would be new for everybody, even for rank 1. But what is the strategy that a topper uses to decode the new terms? So suppose this is a question tissue harmonic imaging is used in. This is a term you've never heard. You've never heard this term. And this does not even sound like a medical term. But still anybody can solve this question if you decode this term. So tissue harmonic imaging. So harmonic, we've all read somewhere in our 11th 12th physics. It is related to the sound waves. And out of these options, X-ray, USG, CT scan, MRI, which one uses the sound waves? USG. So automatically the answer becomes USG. So, this becomes very, very easy to solve. Tissue harmonic imaging, harmonics is sound wave, so USG. So, a very, very important trick to solve new questions. So, start decoding the new terms in the exam. As I said, it's possible only when you maintain your calm in the exam hall. So, kindly do that and follow these cheat codes to score more, the strategies which are used by any topper in the exam. So, hope this helps you. If you like this, please like our video and put a comment in the comment box. If we can help you with any other thing, please to let us know. And in my next video, I will tell you how can you use negative marking to your benefit. How is negative marking actually good, and you can use it to the maximum advantage. How many questions should you attempt in the exam to get a good rank? That is what I would be sharing with you in the next video. So for that, subscribe to our channel and press the bell icon so that you get a notification whenever we post that video on how to tackle the negative marking. So thank you and best wishes. Keep revising, keep winning. So here signing off, Dr. Nikita, your NEET PG mentor.